Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about 5 knee rehab hacks. 5 things that are going to help speed up your recovery and maximize your recovery after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. So these are 5 things that are kind of additional things. So everyone should be doing their exercises, their walking, their pain management strategies. But these are 5 things that are kind of add-ons or additional tips or hacks that you can use to really get the best recovery possible and the most efficient recovery. So the first thing I want to talk about is protein supplementation. So after knee replacement surgery, your muscles are weak, they're atrophied, the force of contraction of your muscles is reduced. So particularly we think about your quadricep muscles in the front of your thigh, but also any muscles of the leg and around the knee joint can be atrophied and weakened. So protein is going to be that catalyst, that thing that's going to help enhance and trigger that building up of muscle strength, muscle fibers, and protein in the body. So a great way to get adequate protein and get sufficient protein is through supplementation. Now, full disclosure, we do have a relationship with Mend Joint Replacement. You can check that out on our website if you want. But there's other resources, other supplements out there that allow you to get the proteins, and particularly the building blocks of proteins, the amino acids or the essential amino acids that are really going to help increase protein synthesis, increase the production and growth of muscles and strength after surgery. And I always tell people you can take it before surgery, a few weeks before surgery, start taking this supplement to help to, maximize how much strength, how much hypertrophy of your muscle you have going into surgery, and then taking it after surgery as well to help improve that rehab and that regaining of the muscle strength. So staying in the same category, talking about strengthening, what I also want to talk about is using electrical stimulation, or you may see it abbreviated as NMES, or neuromuscular electrical stimulation. And so there's different methods and different purposes of using electrical stimulation. One of them is just for pain relief. This is commonly referred to as TENS, or a TENS unit. But you can also use electrical stim to initiate a muscle contraction and help strengthen the muscles. So really common after knee replacement surgery or any type of knee surgery is to put that electrical stim on your quadricep muscles of your thigh and use that 10-15 minutes a few times a day, especially early on after surgery. That's going to help to trigger a muscle contraction and activate those muscles and help build back that muscle strength as well as your knee extension and straightening range of motion early on after surgery in particular. So NMES, or electrical stimulation, is the second hack. The third hack is aquatic therapy or pool therapy. And this is particularly helpful for folks who just seem to not really tolerate the exercise as well, might have a lot of pain, especially with weight bearing, like standing and walking. Folks that just seem like they've kind of hit a plateau with their rehab and with their strengthening and exercise. Aquatic therapy really has a lot of benefits. So one is that the stresses and the weight that is going through your knee joint with doing weight bearing exercises and activities is significantly reduced when you're in the pool and in the water. Also, the pool and the water has kind of this relaxing, calming effect. It really can help kind of relax your muscles, decrease the pain, where you're really able to tolerate a lot more exercise and a lot more different movements when you're in the water. And also, there's just this pressure that is exerted on your body and on the knee joint, and that gentle pressure can also help with swelling and pain management as well. So I think aquatic therapy, pool therapy is a really great exercise, a really great option, especially for those folks who seem to kind of hit a plateau or are struggling with the land-based normal physical therapy. The fourth thing is really more of a tip, I'd say, than a hack. And what it is, when it comes to your exercises, when your range of motion, your stretching exercises, trying to get the bend, trying to get the straightening, focus on consistency, focus on duration, focus on repetitions, rather than intensity. Now we want to challenge our muscles and our joints. We want to find that happy medium where we are getting the benefit from doing these range of motion exercises, from doing these stretches, but we don't have to crank on the knee to the absolute maximum every time you do your exercises. Early on after surgery, the first week to few weeks, you really want to be doing your exercise routine 3, even up to 5 times a day. And to be able to get that many repetitions and doing that many stretches and things, we want to find that happy medium. If we really crank on that knee and really aggravate the pain and the symptoms and the swelling and the stiffness, you're not going to be able to tolerate the continuation of doing those exercises. And it's actually going to be a step back. So finding that happy medium where you're getting those benefits, but not over exerting, causing excessive pain, excessive swelling and symptoms, that's the best place to be. Now, I'm not going to say that you should be pain-free. That's the nature of the rehab in a lot of respects, is there's going to be pain, and it can get pretty intense. But what my main point is, we just don't need to crank it to the absolute maximum where it's going to aggravate things so much that you're not going to tolerate and feel able to do multiple sets and multiple times frequency of doing your exercises throughout each day. So it's focus on consistency, focus on lots of repetition, lots of time, rather than intensity, rather than try to do maximal all-out intensity. And the fifth thing is more for folks who haven't had their knee replacement yet, and that is prehab, or pre-rehabilitation, doing physical therapy, doing exercises prior to your surgery. The more strength you have, the more range of motion, the more walking and mobility you have going into surgery, the faster you're going to see that recovery after your surgery. It's kind of common sense. It seems logical when you think of it that way. The better you are physically, and the better your knee and your muscles are physically before surgery, the better they're going to be after, and the faster you're going to get that return of strength, of range of motion, of walking, all those things. So, wherever you are in your planning for surgery process, some is better than none. Now is the best time to start trying to do some of those exercises, working on your range of motion, your straightening, your bending, working on your strength, working on your walking, your mobility. So that is my 5 knee rehab hacks, the best hacks or tips I have out there. Again, these are kind of in addition to the foundational things, pain management, physical therapy, doing your exercises, doing range of motion, doing strengthening exercises, walking, getting up and walking, and doing all the mobility exercises. Those are the foundational things. These are the additional things, the hacks, the tips. They're going to help speed up that recovery, help with the efficiency and the maximum positive outcome of your recovery. So I hope you found this video helpful. Please be sure to hit that like button if you did. Please be sure to subscribe again if you don't already. And please, of course, leave your questions, your comments below, as I do my best to get back to every person who leaves a comment. Thank you for watching.